Hello, good morning. As I believe that patient empowerment through education about their disease is very important, I would like to start today with urinary tract infection, which is a very common disease which we come across in most of the places, especially in EU and India. As the name suggests, its name is urinary tract infection. There is an infection in the urinary bladder and sometimes it complicates into going into the kidney. Why this happens? Main thing is because there is an organism called Escherichia coli, E. coli, which lives in our gut or in our stomach. So sometimes just because of the immunity being low, this organism travels into the urethra or into the urinary tract from the anal region which is connected to our stomach. Then the symptoms starts. What are the symptoms? Increased urge of urination, burning and scalding, systemic symptoms like fever, dizziness, nausea, vomiting, and increased inclination to pass urine passing drop by drop. In some cases, extreme pain in the lower abdomen. It affects your daily-to-daily life. In females, because of their anatomy, the urethra being very close to the anal region, they are more prone. Sometimes, in case of menopausal women also, because the amount of estrogen surrounding in the area of the pelvic region or the vaginal region is less, they are also more prone. And first and foremost, decreased consumption of water. So naturally, the excretion and the urination is less and there is increased chance for urinary tract infection. Cloudy urine, blood in urine, increased offensive urine, pain while passing urination, pain during sexual intercourse. These are some of the symptoms you face when you have urinary tract infection. It is not necessary when we have to diagnose that all the symptoms will be present in one person. When it becomes recurrent UTI, then what are the measures we can do? Mainly for prevention. First and foremost is drink lots of water. Cranberry juice has been found little more effective during UTI according to studies. Wearing breathable undergarments, using non-diaphragmatic methods for sexual intercourse, keeping the area hygienic, not using any kind of perfumed wipes, emptying your bladder after intimacy, basically cleaning the area from front to behind because the anal region is behind. So from there the bacteria can come to the front area. So we have to do it in the opposite direction. Do not use much cosmetics over the area. More sex, more infection. New partners, more infection. Prone to more infection. Diabetes mellitus. Catheter use. Sometimes if it is not cleaned, if it has used for a long time. All this. And diabetes when the healing mechanism is very low. Non-healthy diet. Basically, sometimes cloudy urine you can see, but there are no symptoms. So these are the cases of UTI. How we can prevent them is by drinking lots of water is the main issue, and to increase your immunity. Immunity you can increase by increasing antioxidants in your body. The free radicals are always circulating in the body whenever we are having junk food or if we are having any kind of food which is not natural. So in order to compensate that, we have to have antioxidants. It can be got through herbal teas or ginger tea or honey tea. So all these are basic supplementary methods, or omega-3 tablets. As I am a homeopathic practitioner who believes in core strengthening of immunity rather than cure, we believe in prevention and treatment in a natural method. Why do only some people get UTI? Here is where homeopathy comes into play. You and your friend use the same washroom. I always tell my patients, you and your friend use the same washroom. She is not infected. Your friend, you are infected. Why? You have to think logically. That is because your immunity is less and hers is strong. How nice it would be if at all your immunity is strong, like a shield, and then you don't get infected, or you get very less infected. Homeopathy aims on that. Homeopathy gives you a power to shield yourself from diseases. That is by just strengthening your immune mechanism, which is already, you have begotten that after you were born. Just strengthening it through holistic method, knowing your mentals, physicals, and your general likes, dislikes. It's very interesting, and giving you a tailor-made individualized medicine which keeps you away from recurrent infections, recurrent allergies, and the results are long-lasting. Many of the people don't know about the benefits of homeopathic medicines, so this is patient empowerment. You know what you have to select for what condition and how you can avoid being sick maximum. Being sick once or twice in a year is normal. That is normal immune mechanism. But more than that, somewhere you have to think. Okay, bye-bye and take care.